Hi, my name is Gary Frenette. I'm a medical oncologist in Charlotte, North Carolina, and I'm proud and honored to be here today with Chris Casta, who's a certified fitness trainer, also in Charlotte, North Carolina. She's helped me and many of my patients achieve really astounding results with diet and exercise, and because of some exciting emerging data that we now have with the use of diet and exercise in our patients with cancer, we wanted to produce a series of videos for our patients. Some of those are particularly challenged because of local therapies they've had, radiation or surgery, that have left them with some functional deficits. We also wanted to create a video for our patients who have completed their therapy and want to continue their path of wellness and continue to exercise and improve their health going forward. So Chris, I'm really happy to have this opportunity to talk with you today. There's a number of misconceptions that I think cancer patients hold, and I was wondering if you could speak to the question of exercise in general in our cancer patients. Is that something they should be considering?
Absolutely. I would say that it's important to make sure that you speak to your doctor and that they have clearance from their doctor. Mm-hmm. But I would say that there are a variety of different exercises that they can do at any point in their therapies, before therapy, during, and after, as long as they have supervised exercise that they will feel comfortable doing.
Yeah, I think, one of the real exciting pieces of information and one of the reasons we wanted to create this video is we now have scientific information that it actually helps patients. What are some of the benefits that a patient can realize from exercise, either while they're getting chemotherapy or treatment of any kind and afterwards?
Well, as long as their exercise is slow and they start progressively working into a program with guidance from a personal trainer, if they can do that, is that they will see that their energy will definitely improve as the weeks go on that they exercise. They will also see just improved body image and just an overall feeling of well-being, besides an obvious strength improvement over time, and also flexibility and range of motion.
One of the things I've seen in my patients is often after their treatment. You would think that the depression or anxiety would come on with the diagnosis, but often there's a period when all your intensive treatment is completed. You've sort of geared yourself up for the actual therapy, and then afterwards there's a bit of a letdown. There's some anxiety there and stress. And I always tell them that that might be a time to funnel that negative energy of the anxiety into a positive outlet, for example, exercise.
Absolutely. We find that people who generally do yoga, Pilates, strength training, cardiovascular training, you always have a different outlook when you're done with the exercise than when you go in. Even if you're having a rough day or it may even be difficult for you and you're feeling it's a day where you're struggling, you go in to exercise, especially yoga, weight training, anything, and you will feel a lot better when you're done. Clearer mind.
And beyond those emotional and psychological improvements, what I really want patients to understand is this emerging data we have. We have data now that exercise and diet, not draconian measures, but things that people can do every day, can decrease the risk of recurrence of their cancer and also improve their survival. We don't have this data yet in every cancer, but we have about the strongest data we have is actually in breast cancer, where we found that patients who take on exercise of about 2 to 3 hours per week of cardiopulmonary exercise and adopt a reasonable diet of 5 fruit or vegetable servings a day had a almost 50% decrease in the risk of recurrence and an improvement in survival. That's as much as we get from many of the therapies that we give, and it's additive to those therapies. So this is something they can do in addition. It's really part of their therapy. Just to go into that a little more, in colon cancer, we also have data from these studies. And these are two kinds of studies, as you know. They're the randomized studies where a group of women are brought into a treatment. Half of them are told to perform diet perform exercise and adopt a very simple diet, and half are sort of followed in the normal fashion. And then their outcomes are follow. That's the strongest kind of evidence we have. We call that category 1 evidence, and because we found that in the group of patients who were given a specific exercise and diet plan, that 50% improvement. We've now seen that in colon cancer, uterine cancer, to a lesser extent prostate cancer and lung cancer. So we haven't studied every cancer yet, but I think there's, as we talked about before, emerging, exciting data that you can be proactive as a patient, and you can do more than just take the medicines or do the surgeries, and you can have an active role in your own health.
Absolutely. Gary, do you find that your patients are exercising on a regular basis?
Well, and that's one of the reasons I wanted to meet with you today and present some of this data, because a number of pieces of information suggest they're not. We know, for example, if we look at our breast cancer patients nationally, after a diagnosis of breast cancer, patients actually exercise less, about 2 hours per week. And a very interesting study was done from the Mayo Clinic. Now, this is a top institution probably in anyone's book, but they looked at patients who had gone through their cancer therapy and randomly took 20 patients and then asked them afterwards, after their treatment had been completed, how many of their doctors had discussed with them the importance of exercise in their health going forward. And it was 0 out of 20 patients. So our deficit here is multifaceted. We have patients who are maybe afraid to exercise after their diagnosis for various reasons, and we have doctors who honestly aren't doing everything they should be doing to try to inform their patients about what I think is increasing and compelling data of the value of exercise in preventing their recurrence and in improving their well-being. Well, Chris, let's just say now our patient has listened to our compelling conversation so far, and they say, listen, I'm ready, I'm convinced, I want to exercise. What are some of the recommendations you'll give that patient when you first meet with them?
Anytime that I speak to a patient for the first time, I would definitely make sure that they had doctor's approval. And after that, we talk kind of about what their goals are. But based on financially, if they can afford a trainer on a regular basis, then absolutely a trainer would be the best, I think the best way to go, because it is important during that time that they have somebody supervising their exercise. So even if you can't actually get in a supervised exercise program, then I would just say try to start with a basic walking program. And definitely it would be a good idea to have a buddy involved, that if you are having a day where you're not feeling well and you're not feeling motivated, that somebody could maybe help motivate you to go take either a brisk walk or a light walk, and then maybe do some light stretching after.
Well, let me ask you more about the personal trainer,
Okay.
because as you know, there's a wide variety of people who call themselves trainers. What are some things that people should look for to make sure they get someone who's specifically trained and educated in this area?
Well, I would definitely ask them their credentials when you speak to them on the phone. First and foremost, though, is have a good rapport with that person, even if it's a telephone interview. Make sure that you feel really comfortable with that person. And it is helpful to find out what their credentials are. They should be certified in personal training, and also ask some of their experience, if they've ever worked with a patient with cancer, or what kind of level of certifications do they have, and even better if they are degreed in exercise sports science, it's even better. But and then also when they meet with them, make sure that they really understand that you have to take it slowly and progressively. There are trainers out there that like to kind of jump in boot camp style and go hardcore, and this is more of a slow, progressive type of program.
Tell me a little bit more. You alluded to the fact that there might be down days, and of course that's going to be the case during treatment.
Sure.
During therapy, should someone be considering exercise?
Absolutely. As hard as it is some days, because not only are you not feeling well, but there is a lot of depression and anxiety that can occur. Usually even taking a walk or doing some yoga will help make those symptoms subside. So I would say absolutely, if they've been cleared to exercise, and even if it is hard, if they can try, it does really help you feel better.
Sure. And you talk about clearance, physician clearance for exercise, which of course is incredibly important. We know, for example, cancer can have certain effects on your body and affect your ability to exercise. For example, in breast cancer, some of the medications we give can cause thinning of the bones, something we call osteopenia, or even osteoporosis when it's more advanced. And also there are cancers that can target the bone and can sometimes weaken the bone. What are some of the exercises that someone who has known bony issues could participate in?
Well, we would use the same rule of thumb for anyone with any osteoporosis or osteopenia, is that we try to do exercises where we take a little bit of the weight bearing off of it if they're really uncomfortable, and say swimming would be a really great option. We do want to counteract that effect by doing the exercises that actually help that. But if they're really feeling uncomfortable, we could do things like yoga or swimming. And we want the exercises where your feet are actually pounding onto the ground, whether it's a step class or walking on a treadmill is another one. Things like the elliptical or swimming or bike riding takes that away. So we want to make sure that we keep the pounding later on. But if you're uncomfortable and you need to start somewhere slowly, then I would suggest swimming.
Great. Yeah, that's a wonderful exercise all around. Let me ask you a little bit. One of the other things our patients are often challenged with is neuropathy. Neuropathy can have a few different forms. It can be painful, sometimes lightning-like shooting pains, either down a limb or within a certain area. Sometimes it can be more of a burning pain, and sometimes it can be a numbness, especially of the hands or the soles of the feet. What are some of the things that we can do for those types of patients, and how does that affect things like balance?
Well, I mean, I do have some experience with some clients that have had that, and we were able to go within their limitations as far as maybe you can still do some weight training as long as they feel it's not too heavy. But what I find mostly that helps that, besides which we've already mentioned, the swimming and the yoga and the Pilates, is that a lot of stretching is really helpful for people like that. But they can do most exercises, and we can work on their balance training. It's not something that we can't do to hopefully help alleviate some of that neuropathy.
And I've seen, honestly, some fantastic results in some of our mutual clients and patients in that regard. Talk to me a little bit about a patient, for example, who might be financially challenged, as so many patients are during their treatment. What can someone do with a little to no budget with regard to training and to therapy?
Well, if they can't afford a trainer, and even so, maybe the YMCA, they would maybe go to some facility like that and see if they can, they do have financial assistance programs, so that's an option. If for some reason they don't have a local YMCA, or they don't fall into that criteria, there are a lot of things that you can do at home with different pieces of equipment, TheraBands, a stability ball. There's all kinds of things that you can do at home. A DVD that you can purchase for either yoga or Pilates or weight training would also be helpful. I would also recommend somebody maybe just going to 1 or 2, even 3 or 4 sessions with a trainer if they can, to just learn the exercises and then go home and do it on their own.
And later on in this video, we're going to show some exercises, demonstrate some techniques. It's not a replacement for having a trainer personally watch you, but it will be better than sort of taking them on your own completely. So
absolutely.
Appreciate that advice. How much exercise should someone aim for, both initially and ultimately, with regard to their exercise?
Well, with any person, we say that it's important to start very slowly, because a lot of people, when they are ready, they're ready, and they jump in full throttle, and they go from no exercise to I'm going to work out every day. And what ends up happening is they can injure themselves. And one of the main reasons that people, I think it's about 80% of people stop exercise altogether, is because they've injured themselves in the first 2 weeks. So we tell people to start slowly and use very light weights in the beginning, and then work up to 2 to 3 times a week is what we really say for weight training. Most days of the week, it's a great idea to be doing cardiovascular training. So the most recent research is saying most days of the week you should do about 30 minutes or more of cardiovascular training, which includes biking, swimming, the elliptical, the treadmill, things that help your cardiovascular system.
Yeah, I think that is very much in agreement with what we're seeing scientifically. And some of the studies we were discussing earlier, showing a decrease in recurrence and an improvement in survival in our cancer patients, targeted about 3 hours a week.
Right.
So that would be what, 4 45-minute sessions or 6 30-minute sessions a week. So It's certainly challenging in someone's everyday week because we all get very busy, but what I like to stress to patients is this is part of your therapy. This is as much of your treatment as your surgery was or your chemotherapy, and you didn't say, well, this is not a good month for my surgery, maybe I'll do it 3 months from now, or this is not a good time for my chemotherapy, but next year looks a little more convenient. And in the same way, I guess I would encourage people to carve out that time and make it your first priority rather than your last priority.
One of the hardest things that we find for most people is the behavior change aspect of exercising and putting it into their life. And so what I tell people is the brushing your teeth analogy is that when we were born, we were not innately able to brush our teeth. Now, you would not go without brushing your teeth every day. So it's the same idea. We want to get you slowly to a point where exercise, you feel uncomfortable if you haven't exercised that day. So how you do that is by slowly adding it into your routine each week. And usually I tell people to give themselves a goal of 1 to 2 times for the first week and set a 1-week goal. And you usually have a reward at the end of the week that you give for yourself. And then once you've accomplished that and you've given yourself the reward, then you go for the next week. And before you know it, 4 weeks have gone by and you've changed different things. So that's how I train people to start to use behavior change in their life.
So that reward can't be not to exercise, right?
No, you have to exercise. That's right.
So that journaling is very interesting. Can you talk to me a little bit more about that? Because that's not something I'm familiar with.
A lot of trainers don't use journaling. I tend to use journaling a lot for people who are really struggling with the behavior change portion of it. I find that people who generally write down what they're struggling with or why they're not exercising helps with the whole program in general. So not only would you write in maybe a journal what your goal is for that week and what the reward is, but a lot of times people come up with reasons of why they're not exercising and they can write that down in a journal. A journal is also helpful to just get your feelings out when you're struggling with or going through a rough time like a cancer patient is. It's a good idea to write down how you're feeling and also just use it as a tool. It's a good thing to keep handy and just writing down why you were successful that week or why you were unsuccessful that week and then move on to the next week.
So one thing a lot of patients aren't aware of until their doctor hopefully tells them is that the average patient being treated preventatively for with chemotherapy actually tends to gain weight rather than lose weight.
Oh, yeah.
And the problem, of course, is that our anti-nausea medications have become very effective. Unfortunately, the fatigue associated with chemotherapy causes them to have a slower metabolism, and as we've discussed, they unfortunately tend to exercise less.
Sure.
So let's say our patient now has completed their treatment and they have a weight loss goal. I know you don't focus solely on weight when you're helping to train a patient. Can you talk a little bit more about that?
One of the things that I do with the client is we sit down and talk about what their goals are, and I try to have them look outside the box because a lot of patients, especially if they've gained weight because of the chemotherapy, might think that their only goal is to lose the weight. And maybe it might be a little bit harder because of what they're going through at that time. So I do try to have them focus on other things that will improve also besides just that. And so I'll talk to them about their overall appearance will improve, but their energy, their stamina, also just their overall feeling about themselves, a better sense of well-being in their life, less stress, all those things I try to have them focus on and really not so much on the weight. Sometimes we don't see the scale change so much, but we do see their circumference or their sizes go down. So what I ask them to do if they're not training with me is to maybe do a circumference measurement of their waist, their hips, their chest, and their arm, and then see if that changes over time, or see how your clothes are fitting after 4 to 6 weeks of exercise, because a lot of times you may not see it on the scale only.
I see. So if you're exchanging, for example, fat for muscle, if your body composition is changing, your total weight can stay the same, yet you're still gaining strength and getting more healthy. That certainly makes sense.
This is a hard concept for people to really understand. It really is important for you to feel like your body is changing and getting smaller and that your clothes are fitting differently. And many people still really focus on the scale, and we do see that muscle mass weighs more than fat, and so as you're getting more fit, you may see the scale go up a little bit, and so it's just to make sure to focus on the right things.
So tell me about the intensity of exercise, and we're probably not talking so much about the patient during therapy, where that intensity obviously has to be modulated to their chemotherapy and other struggles they're going through. But often I'll have a patient tell me, "Boy, I'm walking 2.5 miles 5 times a week and I'm not losing any weight. And when I talk to them, they're obviously taking a very leisurely pace, not breaking a sweat, etc. And it's clear that if their goal is to lose weight and become more fit, they're certainly getting fresh air and helping that to some extent, but not perhaps to the extent they should be ultimately. How do you counsel patients with regard to the intensity of their exercise?
Well, that's the biggest mistake that most people have when they feel like they're exercising on a regular basis and they're not seeing improvements or progress, is that if we really were to put a heart rate monitor on them, which is a polar heart rate monitor where you have a strap around your heart and it monitors your heart and your beats per minute and it tells you how many calories you're burning. And if you don't have one of those on, it's hard to tell where you're at. So a lot of people will go for a walk and their heart rate zone, there is a zone that each of us have based on our weight and our height and our age. And if you are not towards the higher end of that zone, you tend to not be burning many calories and really not putting yourself into what we call the fat burning zone. So many people exercise in the lower portion of their heart rate and they don't really produce a sweat or that they're really exerting a lot of energy for their exercise and they really don't see a lot of results. With a cancer patient, I would say that maybe during the time that you're exercising, during pre, post, or during your treatment, that it's okay to do more of a slower type of workout if that's what you feel comfortable with, but understand that in order to lose weight, you do have to work out at a little bit more of an intensity. An old school way of thinking was just work out as hard as you want, and now we know that that's not really where you're supposed to be. You're supposed to be in your heart rate zone.
Chris, one of the problems I see with my patients, especially after chemotherapy, is they have almost a fibromyalgia type syndrome of chronic pain, a lot of achiness. Is there anything we can advise those patients to do to help themselves?
Yeah, absolutely. Some of the things that I recommend is obviously stretching every day, getting into a regular stretching, if not a yoga type of stretching program will help with that. Also, I just recommend some Epsom salt baths. That also helps alleviate some of the pain. And if they can afford a massage, that also will help too.
Yeah, that's great advice. Tell me, in a related question, of course, because of lymph node removal, for example, in head and neck cancer or in breast cancer where the lymph nodes under the arm are often removed, women may actually have lymphedema or swelling of the arm, for example, or in head and neck cancer, swelling of the neck, or be at risk for that. Can those patients safely exercise?
Absolutely. We definitely have a, more is not better in this situation, though. We want to start really slowly with very, very light weight. But we do find that the people who generally exercise, if they have lymphedema especially, that we do see that they start to notice an increase in range of motion, increase in flexibility, besides the strength. The patients that I've worked with that have had lymphedema have said that they felt a lot better when they were exercising regularly because just the movement and lightweight training.
Well, it's interesting you say that because your personal observations are actually corroborated by, as you know, a study that was published now about 2 years ago in the New England Journal of Medicine when it was structured exercise that was supervised, that patients with lymphedema who actually had the symptom improved many of their symptoms and improved their strength with structured exercise. So the old school discussion was that you should really avoid overuse of that limb or that area, and now we know the exact opposite appears to be true. So I think that's great advice. Tell me a little bit about some of the food choices that you might recommend for someone just completing their course of cancer treatment. Of course, during cancer treatment, especially if you're getting chemotherapy, the food choices are going to be dictated by changes in taste and things afterwards. What about, and I know I don't want to get too much into the weeds in this one, but what about some of the general recommendations we can make to patients while they're exercising?
Well, we find it's important across the board in exercise to be eating. What we see is if you're going to start pretty regularly exercising, that you want to keep your blood sugar up throughout the day by eating small meals if you can, which is probably a little bit more comfortable anyway. So what we tend to tell people is try to keep a protein and a carbohydrate at most meals throughout the day so that you can kind of keep your energy up. So it's especially important if you are exercising regularly because you will burn more calories. And so a lot of times people will stop exercising early because they haven't prepared their body to exercise. So it's really important, maybe an hour or two before an exercise program, that you do eat some complex carbs and protein so that you can make it through the workout. And then when you're done with the workout, you should then again eat so that you can keep your blood sugar up at all times. Many clients of mine have had to stop during an exercise program because their body was not prepared with proper nutrition, and also dehydration is another problem too at times.
And if you don't have the blood glucose going into the exercise, then obviously your body's going to tell you to shut down. And I wear one of those watches, as you told me to measure my metabolic rate, and I notice even after I exercise, I'm going at a pretty good clip for a while, and I can imagine if you're not getting a little bit of fuel in it at that point, that increased metabolic burn rate, if you will,
Absolutely.
will be decreased if you don't get in at least enough nutrition to keep that going. So you can actually be counterproductive with regard to your diet by eating too little around that period. Is that accurate?
Absolutely. And really, besides what I mentioned earlier, that many people stop an exercise routine because they've injured themselves, another one is because they just don't really have the proper diet, so they just feel really awful either during the exercise or after. So it's really important to fuel your body correctly before and after exercise, especially because your heart rate is elevated, like you mentioned, after your exercise, so you're still continuing to burn calories.
Right.
What would you tell a patient who has been exercising regularly and adhering to everything that we spoke about but still develops cancer?
Unfortunately, that's somewhat common, and it's hard to give people a clear answer on things like that, but I make the analogy to driving a car. Some people drive a car, they drive the speed limit, they use their turn signals, they don't drink alcohol and then drive, and they're at a stoplight and someone smashes them from behind.
Right.
That doesn't mean the next time you go out driving you drink and speed and don't follow the traffic laws. It just means that you did everything right and something bad still happened. But remember the recurrence and survival data, and that holds true even after you've developed that diagnosis, of course. That's the whole point of it. So they're still going to enjoy that benefit in terms of recurrence and survival if they continue the same habits, as you mentioned, that they've already developed. So I would tell them that those habits that they've luckily developed will hold them in good stead going forward. Also, they sometimes don't realize that their fitness coming into treatment is going to be a huge advantage for them in terms of their ability to tolerate treatment and the ultimate success of that treatment. And we have a fancy name in medicine for that. We call it your performance status. But basically, it's how fit you are coming into treatment.
Absolutely.
Often our chemotherapy and our treatments are preventative in nature. So someone's not going to feel better taking the chemotherapy because we're not getting rid of a symptom. We're just increasing their chance of being cured of their cancer. So the real issue when you take chemotherapy is, do you start here and end up here, or do you start here with your energy and end up down here? Obviously, if you come in fit and healthy, we're going to be able to deliver chemotherapy on time. We're going to deliver it with fewer side effects. Patients will have fewer late effects related to their therapy because they've tolerated it well. So they still will get many advantages for their good habits prior to diagnosis.
And exercise in general, a lot of people don't understand that when people first start exercising in an exercise program, their immune system goes down just slightly, but then we see it rise up and stay up if you exercise regularly.
That's a great point.
So we have to make, it's a better place to be if you're starting in a situation like that where you have been exercising regularly and your immune system is the best it can be.
Yeah, it doesn't seem fair, but still there are some great advantages for those folks that they'll enjoy going forward.
Absolutely.
Well, Chris, once again, I want to thank you again for sharing your insights with me and with our patients today.
Thank you.
Great. And for our patients, I want to reiterate the importance of what we've talked about today. Exercise is a medicine, and it's part of your therapy, just like the surgery, your radiation therapy, or your chemotherapy was. You didn't delay or ignore those portions of your treatment, and I'd like you to take this portion of your therapy very seriously also. It'll have a myriad of benefits in your life, not only with regard to your cancer prognosis, but also with regard to your general health and wellness. And it will form a great example for your family to follow. So thank you for joining us today. Hi, we're excited to present for you today the second portion of our video looking at exercises you can do before and during your diagnosis of breast cancer. I'm of course here with Chris Casta, our personal fitness trainer, and also Micheria, our office assistant, and she's going to demonstrate some exercises that we can do during that diagnosis.
Hi, one of the most important things that you need to keep in mind when you have breast cancer is that a lot of tightness occurs in your upper portion of your body. So one of the things that I'm going to show you today are stretches that you can do to loosen up the upper portion of your body. One of the things that you can use is a basic towel from your home, and I'm just going to give it to Micheria and put it in the back here. And if you can turn to the side, and what you want to do is just pull your shoulders back a little bit so that you can get a good stretch in your upper shoulder area. This area in particular, even before you have surgery, can really tighten up. So what you want to do is just take your right ear over towards your right shoulder with your hands back this way. Okay, so if you can just take your right ear over towards your right shoulder, what this is doing is stretching out your neck at the same time as it's stretching out your shoulders. Now if you can take it over to the left. And we probably want to hold these stretches for about 30 to 60 seconds. 30 seconds is a long time, but if you can, the longer you can hold it, the better. So the second stretch that I want to show you today is still using the towel, and what we're going to do is put it back here again behind, and I'm going to have Micheria just bend over at the waist, nice and easy. And if you have tightness in your hamstrings, you probably want a slight bend in your knee. And the goal of this is to try to, over time, get a little bit further back so you can stretch out your shoulder blades. Again, holding about 15 to 30 seconds. If the more you get used to the exercise, you can hold it longer, from about 30 to 60 seconds. The most important thing to remember is also to breathe during these stretches, in through the nose and out through the mouth. Okay, the next stretch that we're going to show is a stretch for the front portion of your shoulders. So I'm going to give Micheria the towel here, and I'm going to have you bring your arms straight out. And I just want you to kind of move to the right, stretching out your side and shoulder, and then just move a little bit to the left just to loosen up your sides. The next stretch we're going to show is for the upper shoulder area called the traps, and what we're going to have Micheria do is take the towel, extend your arms out like we did earlier. I want you to raise up as high as you can, and I even want you to push it past your head a little bit to stretch underneath, also down here, and just hold it. Take a deep breath in. Now I want you to lean over to the right a little bit, getting the sides of the body, and then back to the other side. Back to center. Another stretch that you can do, you can use your door at home. So Micheria, I'm going to have you back up just a little bit, and you're going to take your hands up to the sides of the inside of the door. And what I want you to do is I want you to take a big step forward, leaning through. What this is going to do is loosen up the pec muscles right here, which can get very tight for people that have breast cancer. So we want to hold it there for a few minutes. Take a deep breath in. And then you just want to switch sides. So if you can just switch sides for me, meaning just switching the other foot in front. Another stretch for the pec area right here is if you put your hands down a little bit lower in the door frame and take another step through, a little bit of a bigger step this time. Usually you can get a little bit lower on the pecs. And come back, switching to the other side. And come back. And with any of these stretches, your goal is to try to increase your time that you can stay in that stretch as time goes by. The next stretch that I'm going to show you is a really important stretch. It does a couple of different things. It will stretch out your lower body, but it also stretch out your pecs as well. So I'm going to have Miss Sherry lie down on her back. Okay, and I'm going to have you take your arms out to the side. Good, and the other one as well. And let's put palms up. There you go. What you want to do is you want to bend your left leg first. It really doesn't matter what side you start on. We're just starting on the left. And you want to twist your lower body so that your leg comes up and over, okay, and just holding it here. So this is where you're getting the stretch for the lower back. Now, here's the pec right here, and this is the stretch you're getting for the chest muscles. So a very important thing to do to get good flexibility up in the pec, whether it's before or after surgery, is to do what we call a windshield wiper effect. So very slowly you want to go down here toward your body, and then you're going to slowly come back up all the way up overhead. Now sometimes it's hard, and if you can't get overhead, that's okay. But eventually you want to try to work yourself up to overhead. Come back down again. And you could start with a set of 5 if you wanted to, and you can work up from there. The key is to take it nice and slowly and just go to whatever range of motion feels comfortable for you. Okay, now we're going to just switch to the other side. Right knee would come up. You're going to twist the right knee over the body. Good. And windshield wiper effect with the right arm. Slowly down and back up. Now, depending on which side you've had your surgery, if it's not both sides, then I would say just continue to do both sides, though. It's very important to stretch out both sides.
Hi, I'm Gary Frenette, and I'm here again with Chris Casta, a certified fitness trainer. And we're going to do some general exercises now when you're through with your therapy, feeling pretty well, and you want to engage in an exercise program you can take forward for your fitness. So Chris, can you show us some exercises you recommend that the generally healing patient would go ahead and do?
Sure. The most important thing to remember before you start any program is that you want to start with light weights. You don't want to start too heavy, and you want to gradually work up to about 2 to 3 times a week that you do these exercises. So the first exercise we're going to do is a basic bicep curl. I'm going to have Gary show you how to do it. You want to remember to always keep your elbows in towards your body and a slight bend in the knee, and you want to try to pull in your abdominal area. The reason that we say that it's very important is so that you don't use your neck instead. So I want you to go ahead and just raise up slowly. Good, and back down. This is a basic bicep curl. You want to start with, depending on your strength level, maybe about 5 or 8 pounds. It's very important to start lightly with these exercises.
And I told you my abdominals were already pulled in, right?
Yes, his abs are already pulled in. You want to do, starting out, about a set of 10. And then you want to just take a break for a second and take a deep breath. This gives the body the time to your muscles to relax a second in between sets.
And didn't you tell me an interesting statistic that about 80% of patients stop exercising because of an inadvertent injury during exercise?
Absolutely. The reason most people stop is because they add too much weight in too fast and they end up injuring themselves, usually in about the first 2 weeks of exercise. So that's why we can't stress enough that it's important for you to start slowly and progressively with your workout program.
And so we're also going to stress technique, and Chris is going to show some of the correct way to do these exercises so that you can avoid injury.
This exercise is to strengthen the middle back area. It's called a basic back row. So Gary, if you just put the weights up in front for me and pull back and pinch your shoulder blades together. Good. And we're going to start with a set of 10 again.
And you should really feel your shoulder blades pinching, is that correct?
Yes. The reason I'm putting my hand back here is so that you can use that as a guide to make sure you pinch your shoulder blades. So when you're at home doing this exercise, make sure that you can really feel your shoulder blades pinching together. This exercise is for the tricep area, which is the back of the upper arm. So I'm going to have Gary turn for me, putting the weights behind you. Okay, again, making sure that you keep your knees slightly bent, abdominals pulled in. This one in particular, the one that usually people get wrong, is that they end up not pulling their shoulders back before they start the exercise. So if you see Gary just pulled his shoulder blades back first, and then I just want you to push back whatever natural movement you can back to feel the triceps right here. Some of the common mistakes that people do are that they don't have the shoulder blades back, and also they do a swinging effect. What Gary is doing is he's actually flexing his tricep muscle back here. Again, starting with a set of 10 would be good.
And I think naturally you tend to let your shoulders roll forward. At least I do.
Most people have poor posture up in the upper body, so you really want to force these shoulders back to try to get your shoulders back for better posture. This exercise that we're going to demonstrate works the shoulders and the trapezoid area right up here. And Gary, what I want you to do is bring the weights together. It's very important. We went a little bit lighter on the weights here. It is very important to go a little bit lighter because this really can use the neck in the beginning. So what you're going to do is bring the weights together, and I want you to bring the elbows up a little higher, good, and then back down all the way. And make sure, like we said earlier, keep the knees bent, and also abdominals are pulled in. Good. Back up to the chest and back down. Some of the common mistakes that people do with this exercise is they don't go high enough with the elbows. The elbows should be higher than the shoulders, and they usually do too much weight. It's very important to start with a lower amount of weight here. Make sure that you keep the weights together if you can. There you go.
And why would you do that?
Just because it's a smoother movement and
I
you don't
see.
have the weights, and then a little bit more of an equal movement between the two shoulder areas. This exercise is for the pec muscles, and I'm going to have Gary lie back for me. If at home you don't have an incline bench, you can certainly just use a regular bench and just lie all the way back down. I'm going to have Gary bring his weights up, and you want to chest press up, bringing the weights up, and you want to make sure to bring them in a little bit and then back down to about a 90-degree angle and then up. Good. An important thing to remember is to try not to let your elbows go too far down past your chest level. Make sure to keep your abdominals nice and tight and try to relax your neck and shoulders. This exercise is for the rear shoulder. This is an area that a lot of people forget to work out, so it's important that you work the back of your shoulder. This will help with your posture, pulling the shoulders back. So what you can do is, again, if you don't have a bench at home, you can certainly sit on a chair and do this, or a stability ball, but you're just going to sit down on the edge of the chair or the edge of the bench, and you're going to lean forward, taking your hands, palms towards one another, and just bending the elbows and pinching the shoulder blades as you come back up and back down. It's a really good idea to start this exercise with no weight in the beginning, just because there's quite a bit of weakness in the rear shoulder if you don't work it out regularly, and you slowly graduate to heavier weights as the weeks go on. I'm going to have Gary show us with some weight. Good, leaning over as far as you can, palms towards one another. Good, bringing it up and back down. Good.
Do you try to hold it when you're all the way up like this, or?
Just for a second.
Okay.
This exercise that I'm going to show you is called the squat. It's a very basic exercise that you can do, which will really work all areas of the upper leg and also the butt area. So I'm going to have Gary turn this way, and what I want you to do is I want you to sit back into a squat. You can keep weights in your hands just for balance, and it also helps with resistance. What you want to do is make sure you sit way back, Gary, like you're sitting in a chair.
Okay.
Let's have the feet a little bit wider apart, just about hip distance apart is what we want. And you really want to make sure as if you're sitting either on a bench or a chair, because then you have the proper form where your knees are not going in front of your ankles too much.
So like this and not like this.
Exactly.
Okay.
Now when you first start squats, you can really feel them a lot the next day or the day after. So you want to try to start with maybe a set of 10 or 20 the first time. This is a great lower body exercise that you can do at home or at the gym. This exercise is called a lunge, and the lunge is a great exercise because it works almost every muscle group in the lower leg area. So Gary, if you can just demonstrate a right leg lunge coming down, not too deep. And we're going to stay on the right side for 10. And one of the things you have to keep in mind when you do a lunge is that if you notice Gary's back foot is coming up the heel of the foot, and he's not coming too far forward with the right leg, the main important thing is to not let the back knee go too far down towards the floor. Okay. And let's switch sides. Same thing on the other leg, making sure that the back foot, the heel comes up, and that you're not stepping too far out to protect the knees.
Well, I've asked Chris to briefly talk to us about the BOSU, which is a piece of balance equipment that might be especially useful for patients with neuropathy and other balance challenges, but can also be useful for other purposes in exercise. Chris, could you talk to us a little bit about this?
Sure. I'm just going to demonstrate some exercises that you can do on a BOSU trainer. And the reason that the BOSU works so well for people is that it makes you use all of your core muscles while you're standing on it. So all the exercises that we showed you earlier today are going to also be able to be done on a BOSU trainer as you become more advanced. You don't want to start out on a BOSU trainer, but you can certainly come up and step up on a BOSU trainer and just balance yourself. And I have a lot of my clients who hold themselves in between a doorway at first just to start out. But the balancing is making all of our muscles work. The smaller stabilizer muscles that hold our larger muscles together are now being used on the BOSU trainer. So that's one of the reasons why it helps so much with balance and coordination.
That's great, and I think a lot of our patients after chemotherapy and other treatments can have a lot of balance issues because they don't feel the bottom of their feet very well. And so using something like this to help increase their strength and help them compensate for that would be a very effective tool, as you say, as they become more advanced in their exercise. Well, Chris, I want to thank you and also thank Micheria for all the efforts you took to show us these exercises today. Once again, we both want to reiterate how important this is to your overall outcome in therapy, and consider this part of your treatment and part of your path towards wellness. So we wish you the very best in the future.